Aging isn't about slowing down, it's about stepping into your power. Welcome to Don't Let the Old Lady In, the podcast where we challenge outdated beliefs about getting older and embrace wellness, self-love, and confidence. Your host is Lori Gardner, a registered nurse and nationally board-certified health and wellness coach, and she is your guide on this journey to vibrant, mindful living. Each episode will explore topics that nourish your mind, body, and spirit, and how to navigate health issues in the healthcare system as you age, so you can live with energy, purpose, and joy. Let's get started. Here's your host, Lori Gardner. Welcome back to Don't Let the Old Lady In podcast. I'm Lori Gardner. I'm your host, and I'm excited to talk about another hospital safety issue. This is the third episode of the hospital safety series I'm doing to keep you safe and sound in the hospital. And this week, we're talking about something that happens more than you might want to believe. That is medication errors. Now, I want to be clear from the start. This is not about blaming healthcare providers. Hospitals are fast-paced environments. These professionals are usually excellent, but the system has them a little overload. So let's just keep that in mind. So medications are given multiple times a day by different providers across shift changes. And even with systems in place, and really good systems, I will have you know, mistakes can happen. But there's an empowering part to all of this. Many of these errors are preventable. And sometimes prevention comes down to something very simple, asking the right question. I'll never forget the time when I was a young nurse at a big city hospital in New York, and I had left to take on another type of career, different kind of pathway, but I would come back on the weekends to help them out and do a couple of shifts. And I'd been doing this for a few weeks. It was amazing how you can get out of practice, because really to be good at this, you got to be immersed in this healthcare system. And there was a point where I went into a patient to give them their 10 a.m. meds, and there was several in the little medication cup. The patient said to me, "Wow, I haven't had medications since I've been in the hospital yesterday." I was like, oh boy. I quickly took the medications out of the room, double-checked the medication record, and realized it was the patient next to this patient in a 4-bedded room. Well, I can only tell you, I spiraled. I was so concerned that at that point I decided I could no longer come and work part-time because my head was in two different careers, if you will. But you see how this can happen. I saw how it could happen. But asking the right questions, I want to get back to that. Asking the right questions. So let me walk you through a real scenario also. Patient's in their hospital bed. Nurse comes in with medications. They scan the wristband. You know, back then we didn't have as many safety precautions when I had almost made that error. And now they have so many more precautions, but still, it's still even more complicated system. We have to double check everything. So the nurse comes in with medications, and they scan the wristband. They prepare the meds, and everything looks pretty routine to you. The patient takes the medication, but something isn't quite right. Within a short time, they start to feel dizzy, confused, a little bit off. Later, it's discovered the medication wasn't the one they were expecting. So they got the wrong medication. Now again, this isn't about pointing fingers, because these situations usually happen due to similar medication names, timing changes, miscommunication during handoff, shift changes. A lot can go on. But here's the part that matters. No one questioned it in the moment, and that's the gap I want to close right here today. Why do these medications happen? Let's go deeper into this, ladies. Let's break this down so you understand why this happens, because when you understand the system, you know where to step in. Some medications look similar, sound similar, and have very similar names. This is one of the biggest sources of confusion. There's timing issues also. Medications may be delayed, given early, adjusted based on condition, and if communication isn't clear, it can create a risk. Shift changes and handoffs. There's different nurses, different doctors, information gets passed along, and sometimes details get lost. There's allergy oversights. Even with documentation, mistakes can happen. That's why this one is so important to double check. The patient condition. When patients are tired, in pain, and medicated, they're less likely to question anything. And that's where you come in as their care partner at the bedside. Somebody should be there watching all of this. So if you take one thing from this episode, let it be this. What is this and why am I taking it? As a patient, that's what you should be asking. If you're looking at medications and you don't know half of them, stop. Stop and have them explain what each medication is and what it's for. And hopefully you came into the hospital knowing what medications you are on. If anything's different, you need to know why you're getting it, what it's for, and potential side effects. So ask, what is this and why am I taking it? Every single nurse I've ever met is happy to explain this, and they believe that patients should be just as empowered as I do. So that's six simple words, isn't it? What is this and why am I taking it? But they do so much. They slow the process down. They create clarity for you. It's a way to catch potential errors. It can empower you and your care partner to be in full control of what you're getting. The doctor may have just walked out of the room and said, I'm going to discontinue this drug, but it didn't get onto the medication record yet. That's why it's important, because things move so fast, to have that dialogue and be assured every time you get medications that you are clear on what it is. So that question should be asked every time you get medications, not just once, because things change, like I said. So you don't need to be overwhelmed here. I don't want to overwhelm you. It's just taking control, right? You just need a simple system. And so here's what I'm recommending, how you track it. Medication name. Keep a track of the medication name. I always encourage my clients, whether it's the patient that can do it or their care partner, to have a notebook at the bedside, and everything is written down, all the medications. So you want to write down the medication, you want to write down the dose, what time it's being given, why it's being given, and write down how you feel after, especially if it's a new drug, and see if there's any interactions. You know, you can have side effects from a drug, but you can also have interactions amongst the drugs you're already on. So very important to keep that. That notebook is essential. It's where I tell everybody to write down any doctor that comes in to the room to do a consult, because they're going to charge you and you want to check your bill. Write down any treatment you're getting, any imaging you're getting, all of it. It's basically your diary and your journal in the hospital. So write it down on a notebook. If you're more electronic, you can use your phone and create a note. And don't forget, we're going to use those checklists, because I partner with Karen Curtis of the Care Partner Project, and she and her team have amazing checklists on there. So go on there. You can be on your phone and just download it or look at it on your phone. Any checklist related to hospital issues is in there, so check it out. Website is thecarepartnerproject.org. I highly encourage you to get your education there. So doing all this creates a layer of safety for you, right? And sometimes the first sign of a problem is not obvious. So watch for any kind of sudden confusion, any kind of dizziness, any rash or itching, any kind of nausea or headache, changes in behavior, or maybe they just don't seem like themselves. And here's where your intuition comes in again. If something feels off, say something. I have, who is now a 103-year-old neighbor who's been my neighbor for 30-something years, not any family nearby. I'm her healthcare proxy. It's 10 years ago when she was completely alert and oriented, went into the hospital for pneumonia and went to visit her, and she was totally out of it. I'm going to make the story short, but it was not normal. And what the staff saw, they just thought maybe she's, has dementia and it's worsening. I knew better. So I went to the nurse and I said, did you put her on any new medications? They put her on medication that I believe to this day they never would have attributed her change in mental status and her complete confusion. She couldn't even feed herself. They would not have attributed to that medication, because it's an old medication that has minimal side effects, but something in her and maybe some other drugs she's on sent her over the edge. I politely asked them to remove it. They removed it. She was back. So you really have to be on top of this. Again, you don't need complicated language. So here's what works. Sometimes people just need some sentences. So write these down if it's going to help you. You can just simply say, can you tell me what this medication is? Or you can say, has anything changed since yesterday? That's to do with medications, lab work, test results, all of it. You could say, I just want to double check. This one is for, tell me again, what is this? Or you could say, are there any side effects we should watch out for? And do you know if these drugs interact with any of the drugs that my mom or dad or loved one is on? You can also say, can I just do a full review with you of all the medications? I've done that so frequently in the hospital, and the nurses are wonderful. They take you right over to the computer. They go down the whole list. They'll print you a list if they can. You can get a list. So really, and I will say, I always preface everything I do and encourage my clients to do and their loved ones to be, think simple, but be respectful and effective. Because this is a tough environment, and you just get more when you act as a collaborator, not as a confrontational or a difficult person. And there's an emotional side to this I want to talk about. I want to talk about what stops people from asking. They feel like they know what they're doing, and they got it all under control. Or they don't want to question them. They're a little bit hesitant. I have seen so many people that outside the hospital are like amazing leaders, doers, you name it. And somehow we get into this hospital system and they become passive. I think it makes people almost shut down because it's so overwhelming. There's so much emotions going on and so much fear. So just be aware of that part of your emotional makeup as you're trying to advocate for your loved one. Sometimes they think, I don't want to slow things down. They're in such a hurry. I don't want to bother them. Again, I don't want to bother them came up in last week's fall prevention, right? We cannot use that. I don't want to bother them. Just remember, every nurse, myself included, always want to be interrupted. If there's something significant, just do it with respect and be effective and assertive. If it's something urgent and you're not getting the attention, that's when you jump up and down. So here's the truth, though. You're not questioning their expertise, and most nurses will know that. You're just supporting self-care or the care for your loved one. And so most providers absolutely welcome that. If they don't, move on to another one. So let's reframe this a little bit. Instead of thinking, I hope I'm not being annoying, think, I'm helping make this safer. And you can just, as I gave you the example of questions, use those questions, and I guarantee you, any provider will want to respond to you. So medication errors, in closing, medication errors don't usually happen because someone doesn't care. They happen because systems are busy, humans are involved, and things move fast. But you are the most important person because you can slow it down with one simple question. What is this and why am I taking it? And that question, ladies, can change everything. So, again, I want to call you again to download. I will put the link to the carepartnerproject.org in the show notes so that you can get there and get your medication prevent medication errors download checklist. If you're on my email list, you will get it in the email this week. But again, really important information. I hope even if you don't have a loved one in the hospital, you're going to remember one of these tidbits and eventually probably have some sort of hospital experience. So listen to this whole series. I got a lot more. I've already created 2, so go back and listen to those if you haven't. I need to create empowered healthcare consumers out there, so that we, as a collaboration with the team in the hospital and us as the patient's loved one that side or the patient, all work collaboratively to get the best outcomes and best care. So with that, ladies, this is a wrap, and I hope you enjoyed this and got a lot out of it. Please share it with anyone you know, especially those that might be in the hospital. And until next time, don't let that old lady in, and don't get into the hospital. If you can prevent it, prevent it. And until next time, be well. And that's a wrap on today's episode of Don't Let the Old Lady In. Remember, age is just a number. Your mindset, energy, and passion are what truly define you. If this episode spoke to you, don't keep it to yourself. Share it with a friend. Subscribe and leave a review so we can continue this journey together. You are strong, vibrant, and unstoppable. Until next time, keep living boldly, loving yourself fully, and most importantly, don't let the old lady in.